Welcome and congratulations on finding this video. Today I'm going to speak to you about finishing 18 holes pain-free. So I'm a back pain expert. My name is Ian Hart, and we see a lot of people who golf and have back pain, and it's extremely common. We've created a program specifically for that, but what I want to do today is to tell you how you can minimize and reduce your pain throughout 18 holes, and even go the whole 18 holes without feeling pain at all or having a worry about injury occurring or pain and discomfort the next day. So, a few things. For the most part, many people are sedentary these days. So they're sitting down all day, and what that's doing is it's putting compression in the spine, and it's your spine is like a mold. When you sit down in a certain position, it molds into that position. It's not ideal for any athletic endeavor. So make sure that you are not sitting all day before you go and play golf. And if you are sitting for a majority of the day, it's important that you do warm-ups and mobility drills. If you want to check out our mobility drills, we have one in this section on YouTube, so you can check that out. But this is the important thing. If you're sitting down all day, you don't do any warm-up and stretching, your hips are tight, and your lower back and core are weak, that's a recipe for absolute disaster. So we want to increase hip mobility, core strength, and stability around the lower back. If the muscles that support the spine are weak and your hips are tight, every time you go to swing the golf ball, you're going to be torquing your spine, creating microtrauma. So I want you to think about a day. If you're sitting down all day, you don't warm up, and you go and start to hit golf balls, what's going to happen is your spine is now molded into a certain position, your hips are tight. Now you're going in, torquing your spine because your hips mobility is limited, so all the energy and force ends up in the spine. Then you go to pick up golf balls, and each time you go to pick them up, you hunch over and not pick them up properly, and you're creating microtrauma. Literally could be every time, it's like a little prick to the disc, and then the disc gets a little bit less fluid, and over time it degenerates. Everybody all across the world, as they age, the disc degenerates. But we only have so many amounts of spinal flexion and torque that you can put on the spine before it disintegrates faster. So we want to decrease the amount of pressure put on the lower back. And the way that's done is by having the correct muscle structure around the hips, pelvis, and the spine. And also moving correctly while we have that structure set up. So when you pick up the ball, every time it needs to be a full squat. You see how when I go down, all the stress is being put on the knees, the hamstrings, and the glutes. This is actually allowing for more strength and activation of the glutes that can be used during a golf swing, as opposed to leaning over, hunching over, all the stress on the lower back, and then coming back up, and again, microtrauma on the lower back. Until microtrauma builds up, and then pop, you throw your back out, or you have severe soreness the next day, there's compression, inflammation all around the back, and then it limits your ability to play golf later on, and you're shortening the lifespan of playing golf for years. So we don't want to end up bed rest because of back pain. We don't want to stop playing golf because of back pain. So if you follow this simple formula of making sure you do warm-up and mobility drills before ever swinging the golf club, especially if you've been in a sedentary lifestyle all day, or sitting all day, or all week for that matter, and then going to play golf. So mobility drills daily will help you if you are planning to play golf on the weekends and you sit all day. Then making sure that you have the hip mobility, your hips are loosened up, your abs are tight while you're swinging the golf ball, and then as you walk throughout the 18 holes, you're properly picking up the ball by squatting down and keeping your back straight. That's going to prevent major trauma later on. We're minimizing the minuscule trauma or the microtrauma daily, so you're putting money in the bank, allowing your back the less stress, more love, and compassion, and that's what's going to help your overall golf game. So if you want a specific program that can help, we have some mobility videos on YouTube, full body mobility videos, and then we have some hip mobility videos that are perfect for golf and specific for golf. If you want a full program that targets your hips, your abs, decompresses the spine, takes stress off all the area around the pelvis, and then also helps your knees, hips, and ankles, your rotational stability, which is very important for the golf swing, then go ahead and click the link below for our back pain relief program, and you can see the results that other golfers have had following this program, and I'm sure that you will love it and you will see results even if you don't have back pain. So go ahead and click the link below and see if it's for you.